There's this consistent question that has been popping up in my inbox. People asking me to talk about this drug called Viagra, sold under the brand name sildenafil. So sildenafil is a drug that was developed in early 1990s for treatment of a condition we call angina pectoris. Angina pectoris is a complication of hypertension whereby it manifests with severe chest pains and very rapid pulse. So this sildenafil now, which contains an active component called nitroglyceride, is used for treatment of this condition. During clinical trials, the researchers found out that there was a striking side effect that was reported specifically by male patients, where they reported sustained erection. So they went back into studies, and in 1998 it was approved by FDA as a drug that can be used for erectile dysfunction. There's a continued misconception that this sildenafil will automatically make you rise to the occasion. No, even with the use of sildenafil or Viagra, you'll need some stimulation and arousal. So that's why there's a big difference between erectile dysfunction and low libido. Erectile dysfunction is inability to maintain or sustain an erection. Low libido is a total loss of sexual desire. That's why erectile dysfunction is treatable medically, while low libido is a bit tricky to approach it. We shall talk about it someday. So it does not mean that when you pop this pill, you automatically rise to the occasion. No, you still need some arousal and stimulation so that you can perform the act that you intended to do. Normally this drug, it takes around 30 to 60 minutes for it to take effect, and then it lasts for a period of 4 to 6 hours. You see, with drugs we have what we call pharmacokinetics and pharmacodynamics. Pharmacokinetics and pharmacodynamics in a nutshell means how the drugs react to your body and how your body reacts to the drugs. So normally you'll realize that it varies between people because there are a lot of factors that determine these pharmacokinetics and pharmacodynamics, such as age, general health status, metabolism, among others. Some of the side effects of this drug include very severe headache. This is because there is this increased blood flow. So when there is increased blood flow, it means your brain cells are not perfusing at the rate that they used to be. So you'll realize that you experience a very severe headache. This is what happens to those people who have hypertension. You'll realize that initial onset of hypertension, they presented with a very severe pain until they are put on drugs, very severe headache until they are put on drugs. And then another side effect is nasal congestion, and then constipation, diarrhea, among others. Now, there's caution that I need to make with those people who are using this drug, because one, you see, in your body there are some things called receptors. Receptors every drug has what we call receptor in your body. Like when you take paracetamol, they have specific receptors. When you take now this sildenafil, there are specific receptors. One characteristic of these receptors is what we call adaptability. With time, they get used to this adaptability. You have heard somebody say, mimi hata kichwa yangu haitulizwi na Panadol, I need something stronger, because they have been using this Panadol for a given period of time. So prolonged use of this sildenafil will make your body adaptable now to this sildenafil. So it gets to a point whereby you take this blue pill, but still there's no effect. So you'll realize you'll need something better from there. And you see, because your body is also used to sildenafil for maintenance of erection, you will now have a problem in sustaining this erection without sildenafil. Now you see, you have created a very big problem from something that is so minor that you just wanted to disapprove somebody. Just be contented with your game. Give your honest 2 minutes, your honest 10 minutes, and go. Nobody has ever won in these Olympics.